I'm going to talk to you today about four main things. I'll initially introduce our project, which is to think about the reporting of psychological social trials across a range of fields. But I'll start by telling you about social and psychological intervention randomized trials, then talk about reporting guidelines and consort in particular, and the development of this guideline. And then I'll announce what we've brought in the initial phases of this guideline, which will be published in the next 3 months or so. So when we're thinking about social and psychological interventions, broadly what I'm thinking about are ones which have clear social and psychological mechanisms. I'll give you an example in a minute. So we're thinking about different health and social issues. We're thinking about ones which have clear behavioral and psychological techniques and are often quite hard to control. So they would fit well into the Medical Research Council framework. So they'll have lots of components and they'll commonly have many providers. And they might well have interventions which are measured at lots of different levels, and they'll frequently be tailored for different individuals. So an example might be multisystemic therapy. This is a treatment which will be presented usually to delinquent adolescents, and in doing so, this form of a kind of a family therapy will involve both the schools, the courts, and the families themselves, and be provided also at an individual level by psychologists, by social workers, by GPs, by probation officers, by those kinds of people. And we'll be looking for outcomes from health, from education, from criminal justice, and the intervention will not be the same for every individual who receives it. There'll be tailoring. So be clear that when we're thinking about these complex social interventions, there's quite a lot of range of freedom about what's going on in them. They're not as simple as what we might think of as standard drug study, where you'll be commonly comparing active versus placebo. And even those, I would argue, are not always simple interventions, because you'll want to be thinking about the context in which it's provided, by who the provider is, and all of the complexity that goes on. I'd encourage people to think about all interventions as being complex, but more often we tend to dichotomize them into being simple and complex interventions. Anyway, let's move on with this rather simplistic split and think about why we'd bother with this kind of stuff. You've been shown recently a series of meta-analyses where studies have been aggregated together, and most studies end up in this way if they're a popular sort of intervention. And it's important to know and to have the reporting of all of those interventions done really well, so that they can be usefully aggregated into systematic reviews. You need to know clear details about its intervention, about its components. What was that population? What went on in its implementation? How did they do it? In what way? With what frequency? With what intensity? So having all of those details really clearly reported is what you need. So good randomized controlled trial reporting will involve telling you about the participants and the setting, about the intervention and how it was implemented, about what the outcomes were and how they were assessed, at what time points, in what detail, using what instruments, and it'll also tell you about the theory of change. And that's commonly lacking, as I'll tell you in a second, and you'll also want to know about the trial design. And we know that the reporting of particularly psychological trials, but also those in criminal justice, in education, in public health, in social work, in many psychosocial fields, is extremely poor. But let's be clear for a minute that reporting guidelines are not rules. They're guidelines. They're trying to be a minimum set of items to reflect and to reduce bias. And these guidelines I'm presenting today are aiming to provide best evidence and based on best practice and consensus. Now, what I'm presenting for you are guidelines concerning randomized trials. The Equator Network will provide you with guidelines on a whole range of different study designs. Consort, you'll see at the top, refers to randomized trials, but all of these different ones there, including Squire, for example, or Cheers, for instance, is about economic trial designs. Strobe is to do with observational studies. The beauty of going through this particular gateway is that you'll always have the most up-to-date versions of whatever guidelines you might be looking for. They also provide them in all languages that you might want, so you'll be able to find French versions of many of these particular trial designs. Okay. So Consort has been out for a while. This is basically what it looks like. It's a checklist, and it also provides a flow diagram. And there have been extensions to it for looking at cluster designs, and there have been different sort of versions for abstracts, and there's been an extension for non-pharmacological trials, which is currently being updated. So our project, then, is based on this sort of format, and it follows the guidelines laid down in David Mower's 2010 paper. And I'll take you through what we did, and then to give you some of the results. So we looked initially at the main guidelines developed, and we saw from the lit reviews that there were around 89 standards that hadn't been considered in Consort, and we found 239 randomized trials that reported less than half of the sort of standards that we were looking for. People typically didn't report simple stuff about the intervention. They didn't even report things about eligibility criteria. They don't tell you where a trial is conducted. Really basic stuff is just not referred to. When you look at the top 10 journals across all of the fields that I mentioned, you know, public health, psychology, social work, and so on, we assessed all of those top 10 journals in those fields and then looked at whether or not they were reporting these basic features about trials, and they're simply not reported. So we knew that things were pretty bad. We then ran a Delphi panel, and as you can see, you got a large number of respondents about that, and then asked them to recommend items based around what we knew from the literature that seemed to be important for reporting for these sorts of complex interventions, to lead into a consensus meeting later. The consensus meeting then drew participants from the Delphi panel, and we then got them to consider those items and drill those down into what was important. These are the consensus meeting participants, some of whom you might recognize from the fields that you work in. And that's now been written up, and we're just finalizing that at the moment. And we're also going to provide a quite detailed so-called E&E, extension and elaboration document, which will give people examples of how to write up the trial that they're doing, and with examples from all of these different fields to help people explain their trial in appropriate detail and give them a rationale for each. And the stage we're at now as you can see, disseminating all of this and giving people presentations and training around the whole thing. So this is what the checklist looks like. Some of the items you'll see from the column on the right-hand side is blank, where we've decided that what was in the initial consort checklist is absolutely fine. So making sure that people do simple things like use the word randomized in the title so that they can find, so that people looking for your trial can actually find it and understand that it's randomized. Other items, though, we did change. So, for example, in item 2B, making sure that people do explain properly how their intervention was hypothesized to work. It's very commonly not reported well, and yet we understand in the sorts of fields that we're working in, this is really important. You need to know that. Many of our sorts of trials have unit of allocation differences that are not the same as in medical trials. It's much more common to think about how group randomization happens. So, for instance, thinking about a parenting trial and you're delivering that parenting trial in groups, is it more appropriate to analyze that in a clustered way and control for that than to analyze it at an individual level? And people have not really thought clearly about that commonly in the past, and you'll see how we've flagged that up later. Other items include thinking about eligibility for settings and for the delivery of the intervention. We've also been recommended to think carefully about how the interventions were delivered and taken up. So remember, there's quite a distinction between delivery and uptake. And that distinction is commonly not well reported in the field. So that kind of implementation issue that's very well ignored in many cases. And where informational materials are delivered, there are often problems in the reporting around those things. Other issues to do with primary and secondary outcomes, on the other hand, seem to be perfectly well sorted out. Sample sizes obviously need to be well reported, but that was well covered. Matters to do with randomization and internal validity. I think internal validity in general was quite well covered. Much more of the difficulty around our kind of work, I think, is to do with external validity. Matters to do with how trials are applied into the wider field and what do we know about it. Many more problems relating to our sorts of work, that is to complex social interventions, are relating to how data are handled and how missing data in particular are handled. And people don't seem to think very well, in our experience, to do with imputation and multiple imputation and how those details are reported. And so a new item has gone in to thinking about that. Similarly, thinking about randomization and the numbers assigned for all of those. So thinking more carefully about this external validity question of people will put in their flowchart the numbers that were initially screened, but they won't say where did those numbers originally come from. So thinking at a population level and then starting their flowchart at that point and looking at numbers approached and really going back into the system. So we've been much more clear in the flowchart about how those things really ought to try and work, and giving people model flowcharts and being much clearer right the way through the system on how that really ought to work to try and give people transparency in all of that. Okay, so a few more rather simple points. Getting people to be much clearer in their table about baseline characteristics. There was some controversy, you may remember years ago, saying that in a randomized trial, you don't really need to report baseline characteristics because they're randomized, they are the same at baseline. But of course, that isn't necessarily true. There are small randomized trials, and it's quite possible for all your blues to be in one group and your greens to be in another. And so it does matter, and it really does need to be clear that your socioeconomic variables should be reported at baseline as well. Getting all of these secondary outcomes reported clearly as well, and being very clear about all of those. And we've made sure that all of these kind of issues to do with registration are reported similarly. A new item is to do with declaration of interests. We expressed it as this way, not a conflict of interest, because there's some uncertainty around funders paying for trials, but also of developers of materials. Again, a parenting example might be a good one to take, of people who have been developing a trial and a manual, perhaps, that could be saleable later, and they're testing it themselves. There may be advantages in that, of course, because they'll implement it particularly well. But at the same time, they may want to be selling it as a for-profit item. So getting together and being clear about where are those potential interests, and just being transparent about all of that, I think is what's wanted there. Then there are some new items, again relating to stakeholder involvement, and thinking about the developer in the design, the conduct, the analysis and the reporting, and any other incentives that might have been part of the trial. That's becoming an increasing issue in psychosocial trials of all kinds, and so that's gone into there. Okay, I hope that's given you a good overview of where we're at with this reporting study. As part of this talk, what I've also done, and it'll be uploaded for you to have a look at later, I've also put on some of the publications that have resulted from the study already, and details of contacts from all of, so there are the publications so far. I've also put on the editorials which relate to it from the different fields that we've had so far, and details of contacts in all of the different fields from the advisory group and so on. So if there are people that you recognize from your particular field, all of these people are willing to be contacted and have details about how consort SPI relates to your particular field, and are very happy to take questions and to give you details that relate to it. So there you are. Thank you.